this special event. This is very special and it's mainly meant for the people who make this world a very special place to live in, all the women around us. This welcome goes out to all the people present here and the people who are watching the seminar live on the internet. ASTER Medical Centre's webinar is the first of its kind event in the UAE and is meant to benefit everyone who is present here and those who are connected live. We have a panel of doctors and guests and more than 100 beautiful women here from the Khail Gate Malayalee Association who are present here to make this pink event a successful and meaningful one. Khail Gate Malayalee Association's Ladies Wing has joined with ASTER Medical Centre to make this a very successful event, to make it beneficial for all the women living in Khail Gate and people who are watching this live. We will start the function with a silent prayer. We know health is wealth and the women's health is very precious for the entire family. Today on this pink day in October, which is celebrated as Breast Cancer Awareness Month across the world, I'm glad to be part of such an event. My name is Sajila Shashindran and I am a senior reporter with Khaleej Times newspaper in Dubai. I'd like to apologize for the delay in starting the session due to an unforeseen accident. Because of which I am here as a moderator and I am filling in for someone else. Most of you know that I was part of the volunteering team and I was not meant to be sitting here, but just with 1 hour's notice I am here as a moderator, so please bear with the shortcomings in the moderation. So I would like to go straight to the event and introduce the wonderful guests here in the panel. Let me start introducing the guests from the experts in the seminar. We have Dr. K.R. Rahul S., the specialist gynecologist from ASTER Medical Centre in Business Bay. A very warm welcome to you, Doctor. Dr. Mahendra Rajan, specialist general and laparoscopic surgeon, ASTER Hospital in Dubai. Welcome, Doctor. I'm glad to see a man sitting with all the women here, yeah? Dr. Asta Misra, who is very familiar to most of us in Khail Gate. She's a specialist gynecologist with ASTER Medical Centre in Al Quds. Dr. Usha Sethi, specialist gynecologist with ASTER Medical Centre. TCOM, yeah? We also have some more special people sitting here, especially Mrs. Premi Matthew. She's the founder of Protect Your Mom and Hair for Hope India. You might have heard about Hair for Hope, where women like us who have long, beautiful hair, they donate it to the cancer survivors or cancer patients. Those who undergo chemotherapy, you know that they will lose their hair, and then people like us who are healthy enough, we can donate our hair to these women and give them more meaning to what we do, you know. So she is a campaigner for this kind of an initiative, and we would like to welcome Mrs. Premi Matthew to this event. And we will be going straight ahead to the seminar. Doctors, we know that we are all from different though you are all connected to the women's health, you are all handling different sections of women's health. So we will start with Dr. Kea itself, the specialist gynecologist with ASTER Medical Centre, Business Bay. Doctor, today we are discussing about breast cancer awareness. So could you please briefly tell us what exactly is breast cancer and how it is affecting not just women but the men, and how it is affecting the families? What is the kind of impact that it has got in our society?
As you can see, it is clear-cut written that 1 woman out of 8 is affected throughout her life, anytime, if she survives till the age of 80. And let me tell you, it is the most common cancer amongst women. So it is the most common cancer, and it is one of the cancers or one of the lumps which a woman can diagnose on her own. She doesn't have to go to the doctor, but if she diagnoses and examines herself first, she can come to know about it, and then she can go and consult a clinician. Another thing, that because a woman's lifespan is a little longer than a man, as this thing, she has more chances, and it is more common after the age of 50. Two-thirds of the women have it after the age of 50, and rest of them between the age of 29 to 40. And all the women should start doing clinical breast examination after the age of 20 every 3 years, and after the age of 40 every year. And if your clinician who is examining you suggests that you require further investigations, then they will be advising you ultrasound and mammograms. And there are high risk factors. Being a woman itself predisposes you to this cancer. Another thing, that if a woman gets menarche, that the first period starts before the age of 12, if you deliver your first baby after the age of 30, if menopause is attained after the age of 55, and obesity, dietary factors, and most important thing is gene linked. If anybody in their family, their mother, sister or daughter had cancer, then they have 3 times more chance of developing this cancer. Another thing, it is gene linked. Normally cancers are gene linked in 10 to 12% of women, but the cancer breast is 65 to 80% linked to gene. The genes are BRCA1 and BRCA2, in which if there is mutation, then there are chances of 60 to 85% women developing this cancer. So you can see that there are many things, and but the most important thing is awareness. You should be aware of your body, which is very important.
Thank you so much. Dr. Asta, probably you can tell us the kind of prevalence of breast cancer in the UAE and India, because most of us are Indians sitting here and we live in the UAE. So if you could start with that figure, how alarming is the situation, and what are the authorities and the doctors doing to spread awareness to make this number come down and take preventive measures?
I'll sit down only and answer you. Actually, the breast cancer prevalence is getting more commoner in UAE now, and even in the India, because as compared to the earlier things, the dietary factors and the environmental factors have got a great effect on the increase of the incidence of the breast cancers. The second reason, now we come to know that there are many breast cancer patients, because now the women are more aware about that. Because earlier were the stages, they are never bothered about their health or anything, and everywhere they never used to go to the doctors, so they never bothered about their health. So they used to get it detected very late, and many of the people women will die also before getting diagnosed also as the breast cancer. But now, as we all are here, we know our health and we are little more aware because of these type of campaigns and everything. The overall incidence has reported to be more in India as compared to the UAE. The UAE population itself, the Indians who are living here, they are not that much affected as compared to the local UAE who are the Emiratis here. From there, the incidence is more as compared to the Indians which are living here. Maybe because of their lifestyle and the dietary habits and all, because they don't go for the healthy foods like too much of vegetables and fruits that had less phytoestrogens and things like that. The breast cancer usually is related to one of the hormone that is called estrogen in the body, and some of the foods which are present, which we normally consume, which are not healthy, they have a lot of natural estrogens in that, and estrogen is the mainly responsible for causing all these problems. So because of our lifestyle and things like that, these things have become more common. But as we know that a lot of screening things are available now, and we can all avail that, and we are the person which can actually detect, and actually we can go detect our problems in the breast on our own. before even going to the clinicians also. So that's why they say that the breast self-examinations are very, very important thing, and all the women, the best time to examine will be after they finish their periods. That's the best time, because if you try to examine your breast before you start the periods, the breast always appears to be dense tissue. That's normal because of the hormone changes. So the best time is to examine whenever you finish your periods. And if you start doing examination on yourself, which later we are going to demonstrate the slides also, that how to do the self-examination, then within 2-3 months you will actually come to know how is your normal breast feeling like that. And if any problem happens, anything appears, then we will be the first person actually to know that our breast is having some problem, and that is the time we can go directly to the clinicians. Screening methods and everything are nowadays very much prevalent, so that is also one of the thing. The normal Cancer Society Association, the prevalence, they say that all the women, whether they are asymptomatic or they are symptomatic, they should actually start the annual mammogram. That means the mammogram every year after they are 40 years of age. That's the cutoff point. Anybody who has got a family member who has got a breast cancer in them, then the screening should start annually 5 years before the relative had the cancer. Like if anybody is her mother or sister, anybody has got the cancer at the age of 35, then actually for the females the screening should start at 30. But otherwise for after 40 years, it's an annual mammogram. Annual clinical checkup by a specialist doctor is also required after the age of 40 years, and in between actually we can follow up with our breast self-examinations. So this is the main thing, and even if you have less than 40 years of age, then you can go for this only breast self-examinations and the clinical examinations every 3 months, every 3 years if it is possible. But as I am again telling that breast self-examination is the most important thing. We should all learn how to do it. We will be showing you on the slides also, and that is the most important thing that we can do as an awareness, as in screening for our own health.
Thank you so much, Doctor. I'd like to take the next question from what you said. Yeah, you said about some kind of foods which could, which could cause cancerous situations. Maybe some kind of food which are not right. The way we are eating are not right. Probably the way we are mixing some food types are not right, and the kind of lifestyle issues. So what sort of changes do we need to take, and what sort of food that women are there that people, or especially women, should avoid, or the kind of changes that they need to make in them?
The breast cancer as such is associated with certain avoidable as well as unavoidable factors. The avoidable factors like the obesity itself, which is dependent upon the food we eat. The food basically which is problematic and leads on to the associated with the breast cancer is the high oily diet, okay, and alcohol consumption. Then it is also associated with certain radiation exposures, either occupational or repeated exposures of the chest x-rays and CT scans and all. As Dr. Astha already told, that it is associated with the more hormonal exposures like estrogen, whether in the postmenopausal age or early menarche or the late menopause, exposes you for the more estrogen throughout the life. And hormonal replacement therapy in the postmenopausal age also exposes you for, predisposes you for more of the breast cancer. Even the other things are like if you have some personal history of the breast cancer, there's always chances of recurrences, and avoidable factors are always diet, stay away from alcohol, exercises, avoid obesity. This is what we can do to prevent ourselves from, or to keep ourselves away from the breast cancer. Thank you.
Doctor, again coming back to the lifestyle issues. We know that the UAE is a place where a lot of lifestyle disorders are affecting the entire population. So could you please briefly tell the women around here, what kind of lifestyle modification that we need to do? Basically, what sort of routine that we need to follow, in terms of exercise and in terms of food intake, water intake, rest, sleep, all that?
This is a normal myth that anybody who comes to India, they will always gain weight in Dubai. That's a very common thing, because it's not only our lifestyle changes here, but the food there, it's offered to us with a lot of shopping malls, and everywhere whenever you go, there's a lot of like a fast food chain here. So these all things definitely make us more obese here as compared to the India, because India, of course, it's not that much freely available, all the things. And even India, that physical work is little more as compared to here, what we follow the lifestyle. It's not only about the working women, they are going out and doing the job and all. The people who are at home, they also have to take good care of their health. That is very, very important for them, because it's the woman health that matters, the health of the family. Because if you are not healthy, of course your children will also suffer, and of course your partner definitely is going to suffer. So the whole family health always focuses on the woman's health. So we have to take care of ourselves. What I will advise that in spite of going for all these fatty foods and whatever junk foods are available outside, just try to pay more attention towards the green leafy vegetables. That's the most important thing. The milk is also a very good thing for the females, because as well as it has an antioxidant property to protect against the cancer. Otherwise also it provides you with a lot of calcium and things like that. So that is also one of the things that is always lacking in a woman's diet if you go for if you check any woman's diet in the family. And always try not to be fasting for a long time. That is also very important. It's not that you are getting up and finishing all your work and then you start eating around 12 o'clock, because by the time your basal metabolic rate and all the things is already down, and your body already is in the need of lot of glucose and all. But I have seen with so many patients that they always say, doctor, we don't have time in the morning, because we have to make ready the children, then we have to make ready for the spouse, the partner, and then afterwards we do household work, then we eat. So this is not the right issue. Try to always eat the frequent meals. It's not that you are eating at 12 o'clock and eating 2 meals a day. That is going to increase your more fatty, it's going to make you more obese, because the thing is that if you are fasting for a long time and if you start eating after that, definitely anybody will eat more. So then your basal metabolic rate always, because of the fasting glucose, it starts depositing the fat in your body. So that will increase more fatty things. And you will always think that I am not eating, but why I am getting fat? So this is the reason, because when you are not eating, then the body glucose is less, so they start absorbing the fat in your body. So always the green leafy vegetables are the best thing to eat and include in your diet. Lot of salads and all the type of sprouted things are also very good. Always try to take out from your busy lifestyle, whether working, whether at house, at least 20 to 25 minutes of daily walking. If you cannot go to the gym, if you cannot do anything at home, if you don't have a treadmill at home, of course the people who have treadmill also, they don't use it regularly. It's just used like a thing and to put all the things there. So yeah, usually Dr. K is right, it's just used as like a towel rack only. So it's better if you don't have a treadmill at home, you go out, just walk for at least 15 minutes to 20 minutes a day. You will really feel fresh also, and that will increase your metabolic rate also. And it itself is a very protective factor for all the cancers and everything. So doing a good exercise and eating healthy, drinking lot of water, keep away stress from your life. Because everybody is stressed here. In Dubai, if you go and talk to anybody, everybody has got some sort of stress. But actually we have to take it out, we have to balance our life out from that. Because stress will keep on coming and keep on going. But our health, we have to take care, because once it is gone, it's very difficult to get it back. Okay, so stress also in the Dubai, it's very, very common. We should try to avoid that. Go for good walk and always think about your health also. Don't always keep on thinking about the health of the children and the health of the husband, because you are the most important people in the family. Okay?
That's a very good piece of advice, not just for all the people out there, for me personally as well, yeah. I just start to walk the talk, yeah. Okay. Now we'll come to Dr. Mahendran. Doctor, we spoke about the symptoms and we will have to start self-examination and all that. So at what age does a woman or a girl should start in self-examining her breast, and what are the signs of the diseases?
Yeah, see, most breast cancers are dealt by surgeons the world over, and in most in big cities and big urban areas, you have breast clinics and breast services, which means that the entire unit, there's a group of doctors solely dedicated to breast diseases. So, worldwide, it's, I was talking to madam here, breast cancer is a Western disease. It is not a disease of this world. It's a Western disease. The highest prevalence rates are in Scandinavia, in Australia, in North America. The entire hype about breast cancer awareness is because it is a Western disease. So if we talk about prevalence rate, we talk in terms of how many develop cancer every 100,000 women of population in an area. So the highest rates are in Scandinavia, in Finland and Norway, where it's more than 90 plus. In the US, it goes more than 60 plus. In Australia, it's around 70 to 80. In India, it's around about 20, 30. And even in Dubai, in the UAE, it falls to about 30, 40. In UAE, even now, I think they are in the process of getting a cancer registry, so you don't have a good population census in this area. And most of us, and the 85% expatriates who keep moving in and out, so it's very difficult to get a good hold about how many, the prevalence rates of cancer in Dubai. So most advices which come, or which we talk to you today, is because of what the Western people have learned, because they are burdened by this disease to such an extent that, and they are also advanced medically, so they have set up protocols. And the protocol wise, breast self-examination starts at age 20, right? They talk about monthly self-examination, and my gynecologist here will tell you how to progress with the self-examination so that no quadrant, no area is missed. Now, when you do a self-examination, it's essentially you try to see something. So everybody, as you keep examining at a time when the breast is normal, you know how a normal breast feels like. So later on, when you keep repeating it, even a small abnormality you'll be able to pick up. And the primary symptom of breast cancer is a lump. Very seldom is this lump painful. It is just a small hard lump. It's like a small peanut or something within the breast tissue, quite deep on the breast tissue, and you will feel it. It's very easy to feel, and it is the earliest detectable abnormality by clinical examination. What you see and what I as a surgeon see is the same thing. Our manners may vary, we may go more methodical, but what we do is we palpate the breast completely. And the other area, the lump in the breast or any lump in the axilla, these are the two things we have to see. So this is what a breast examination, both the self-examination as well as a clinical examination covers. Pain is not a big symptom of breast cancer. So most of these are painless. That is the reason why in developing countries this is missed, because people tend to believe that it is not a problematic case because there isn't much pain to it. But breast cancers do develop without much of pain. There are small variants of breast cancer which present differently. There's something called a Paget's disease of a nipple, which is also a breast cancer, and it doesn't present like a mass. It presents like an eczema. You know, there'll be a cracked nipple which oozes a little bit, which becomes reddened a little bit. That is a Paget's disease of a nipple. It's a variant of a breast cancer. That doesn't present like a mass. That is one exception to the rule. The other exception is something called inflammatory cancer. It will present exactly like a breast abscess. You will have a reddened area, it will be warm to touch, it will be a little painful to touch. But these are relatively rare variants of breast cancer. But for general purpose, the primary symptom of breast cancer is a painless lump which will always grow. And breast cancer never lies quietly for any length of time. Now, this is the primary disease. Very occasionally, people can have symptoms because of a secondary, which means they have missed a primary. And the secondaries can become a big lump in the axilla, a big lymph node here above the clavicles, just at the base of the neck. You can come with headaches, you can come with seizures, you can come with lump in the abdomen, you can have metastasis, the secondaries in the bones which can cause bone pain, especially bone pains which are which aggravate in the night. So these are the symptoms of secondary cancers, of breast cancer. But for practical purposes, what we try to tell you today, and the take-home message definitely is just this: look out for any abnormality in your breast when you examine. It's usually a painless lump. Now, having said that, most lumps discovered by women in the breast are not cancerous. So one need not get alarmed because you've seen a lump, and especially it's related to a lot many other factors like genetic factors, like at the age at which you diagnose it. But every lump which you see in the breast has to be followed up, and that is a rule.
Thank you so much for that, doctor. Actually, I believe some of the points are like fresh information even for me as well, that pain is not at all a symptom for breast cancer. Like most of the women think that if there is some slight pain over there, people could, and because of this, more awareness is also causing more alarm among the women, So that was a good piece of information from yourself, doctor. And as you mentioned the symptoms and about the lumps and all, when should actually a woman start worrying about the symptoms? Any abnormality is a concern, but when does this actually become a worrisome, fact?
See, once you see a lump, obviously you will run to a doctor next. You start worrying then and there. When you can't tell them not to worry. If you have a lump, you're going to get worried. It's obvious. So unless you know what caused that lump, the worry ceases only when you get a clear answer. If you know it's a cancer, your worry ceases. Then you start worrying about different things. There are other things which come into play. But you have to know what exactly the lump is. The commonest lump in a reproductive age group is probably fibroadenomas in the young age group, or fibrocystic disease in a little older age group. They are not cancerous. Now, so whenever you see a lump, it has to be investigated. And the way you investigate it by triple assessment. One is a clinical examination which is done by a doctor. So they will define exactly what the lump is, and we follow certain parameters: how big it is related to the size of the breast, whether it's moving or not, whether it's fixed to the skin or to the underlying chest wall, whether there are other lymph nodes, whether there are other lumps in the breast as well. The second is some kind of a radiological investigation. So as a rule, see, when in a younger age group, when the breasts are quite dense, mammogram doesn't have a role to play. It doesn't pick up very well. In less than 35 years, the preferred modality is ultrasound or MRI. You do not do a mammogram in somebody less than 35. You will not find, you will have a very high false negative rate, and because the breast tissue is quite dense, you will miss a lot of findings. So mammogram is reserved for women more than 35. For people more than 35, of course, it's mammogram, supplemented by maybe ultrasound plus or minus MRI. But the recent consensus is that mammogram and MRI plus clinical examination provides the best possible way to pick up cancers, because among radiologists there are ways of defining which is suspicious, which is not suspicious, and they have a scale which they present to the surgeons, tell them, okay, this is very suspicious, do something about it. So nowadays, and especially in the US, they have combined mammogram, MRI, and clinical examination. That's the best possible way to detect a cancer. And the third is some kind of a tissue biopsy. The radiology may be very suggestive of something, but unless you pick up some cells from that mass and you examine it under a microscope and do some further testing, you will not know what it is. And that is the third part of a triple assessment, and that is an image-guided biopsy. Some could be a fine needle aspiration. You put a very fine needle, it's actually much smaller than the needle you get to take an intramuscular injection. So you pick up a few cells, see it in a slide, and it is about 90 to 95% accurate in diagnosing cancers. If it does not tell us the full story, then we use a bigger needle. It requires a small local anesthetic in that region. It's a little bigger needle than that, and that gives more. It picks up more tissue, and we can get a better diagnosis with that. That's called a core needle biopsy. And these days, people use something called a vacuum-assisted core needle biopsy. It's extremely simple. You have an instrument. Under ultrasound or mammogram, you see the lesion, you strike it under the guidance of ultrasound or mammogram. You know exactly you're in that mass, whichever is suspicious, and then you fire this gun. It will just pick up samples, and then you send it for for a histopathological or biopsy examination. So these are the three things you must do when anybody sees a lump in the breast, and only then we can be sure of telling you whether it's a cancer or not cancer.
Thank you so much, doctor. But doctor, you just informed us about this triple biopsy method, which is the latest triple assessment method, which is the latest, being practiced in different parts of the world. But I don't think that kind of an initiative has happened here. It is still, what we hear is more about mammogram. Do it every year. There has been debate over this also. What is the necessity of doing it every year? Will it cause more? Will it be more useful, or will it cause any damage? What is your view on that?
See, mammogram routinely starts after 40 years. You need to have an annual mammogram. It's equivalent to about 2 or 3 chest X-rays. And radiation, it's a very low radiation, so you don't have to be worried about radiation exposure when you take a mammogram. And protocol-wise, women above 40 have to start on annual mammogram. It starts earlier if you have a family history. Now, the most important, from a clinical point of view, the things when anybody walks in with a mass in the breast, the single most important factor is a family history. Everything, your risk of developing a cancer is based on the genes you carry. See, there are around about 10 to 15% of cancers are caused by some problem in your genes on which you have no control. They call BRCA1 and 2 genes. So we ask patients about whether there are any close relatives who have had cancers, breast cancers or ovarian cancers or both. So there's a gradation. It's mother or sister, first degree relatives, whether they've had breast cancers, if they had 2 breast cancers, if they had breast and ovarian cancers, or aunt or anybody who has had or 2 or more first degree relatives like aunts or cousins who have had cancers, family history of male breast cancer. So these are the things we ask for, and especially in a family history, the age at which the relative developed a cancer, if it's less than 50, it puts you at a higher risk of developing this. I think it's risk is into 5 of developing a cancer. In such case, we are heightened, and then the workup is more diligent. So once we have a family history, and especially if there's a big family history, then you have to go for genetic testing. It's about BRCA1 and BRCA2. These are two, if we have any problems in these genes, these genes produce a kind of a protein which repairs the DNA. See, all cells multiply. Human is constantly evolving, and the cells die, new cells are produced. So this process is very, very delicate, and it all starts when the DNA multiplies. But in the world, there are a lot of imperfections, but the nature has given us a regulatory mechanism whereby these imperfections are weeded out. So if there's some gene which is not okay, there are fallbacks in our system whereby that gene is detected and is deleted. So there are proteins which actually do that. BRCA1 produces that kind of a protein which detects small problems in the genes which are not okay and which can lead to cancer. So once it sees that, it deletes that gene. If there's a problem with this gene which doesn't produce a protein, then those genes which are not good, the DNA which are not good, can proliferate, and that causes cancer. So if the family history is very strong, you will have to test for this testing for BRCA1 and 2, and then we go by the regular protocol of the triple assessment.
Dr. Kaya, you just mentioned here that 1 in 8 women suffer from breast cancer. So unfortunately, if one woman finds out this reality, that she is a victim, or she is now suffering from breast cancer, what is the next thing? What should be the next course of action? The kind of emotional, the psychological or clinical things, or whatever that she is supposed to do.
A very good question indeed. See, once you have seen or identified the lump by yourself, don't come to any conclusion. Go to the clinician, let the clinician examine your breasts, let the ultrasound of the breast and mammogram be done, or MRI according to the age. Once it has been diagnosed that yes, you are having cancer, or it has been declared to you, take it coolly. See, the medical fraternity and medical science is so advanced, it can help you at any stage of cancer. It has all the amenities, the surgical, the medical, the chemotherapy, as well as the psychological counseling also. But the best counselor for you is yourself. There is nothing in this world which you cannot defeat, provided you are strong enough. And let me tell you, a woman, Dr. Mahindra, I am sorry to say that, a woman is much, much stronger than a man. Physically, emotionally, psychologically, in every way, in every aspect of life. And she can fight this battle with all the grit. So it is you who has to help yourself first, and of course your partner is there, your whole family is there with you. And I have seen so many cancer survivors. Of course, I met a very nice person today. It was a pleasure to meet her. They have fought with such grit. I'll give you one example. I had a neighbor, and she had come to my house on Diwali. It was my first Diwali in a new place, and she was all decked up, all very well decked up with Maharashtrian, of course, with all the nose ring and all. And I found it very strange that even after 10 years of marriage, she was all decked up for Diwali. And after 2-3 days, somebody told me that she is a cancer survivor, and now she wants to make the most of her life every day with a fresh start and try to make the most of it. She was a professor in a college. She learned driving afterwards. She bought a car, and then she survived for the next 15 years. And her kids were very small, let me tell you. They were just 5 and 3 when she was diagnosed. And the way she fought, I remember her almost every week because some of the other patients I come across. So one thing is the emotional aspect. Second thing is, of course, your doctor is there with you. And most of the doctors are gifted with a very good method in counseling. They are your best friends, provided you open up with them. If you are keeping questions and things to yourself, then there may be some hindrance. But let me tell you, your doctor can be your best friend. Okay, they always have time for you. You have to just ask them. They are there with you. Third thing is that there are certain NGOs everywhere in all the countries who are again there to help you, even financially also. And these are the things which can help you. I'll not take much.
Thank you, doctor. So I guess the message is eat the apple but don't keep the doctor away, okay? Befriend your doctor and keep a good rapport, open up and discuss whatever problems you have, and that's how we can go ahead. And coming to you, Mrs. Premi Matthew, we just talked about the support system and the role of NGOs and friends and families. We know that you are doing such a great role in this kind of a job, you know, this kind of a role. So could you please tell us your experience and how we all of us as women and, you know, mothers, sisters, friends, what can we do in supporting cancer patients and survivors?
Cancer is like a scary word, as you know, so everyone gets scared when you hear that you've got cancer. So what we've done is, I have 2 campaigns. One is called Protect Your Mom on Facebook. So how many of you are on Facebook? Can you raise your hands? Okay. Alright, I'd like you to join me on Facebook. It's called Protect Your Mom on Facebook. What we do is we have these children as young as 8, making sure their moms do what she said. You know, check for lumps and other signs of breast cancer, because you're so busy with your life, you don't have time for anything. We know, I mean I know. So what I do is, and I have students as young as 8, as I said. Not one, so many of them. And I don't know whether you saw them on Asianet the other day. If you have not, just go to my page. It's called Protect Your Mom and Hair for Hope India. On that you'll find 3,000 students of DPS Sharjah, you know, taking home a little message for their mom saying that I love you. That's all they say, because they're very small. And they make sure their moms, you know, understand that they're very precious to the kid, because you're hurting the children when you're ignoring yourself. Imagine your children without you for a day. They can't survive, right? So that's what I do. I have this campaign called Protect Your Mom, and all of you can be a part of it, because I make the students do dances, songs and posters to create awareness. So even you can send me posters from today onwards. Posters as simple as this, right? About creating awareness that 1 out of 8 can end up with cancer, and that early detection is very important. That's the main message we convey to the mother. Because a lot of ladies, especially among the Indian community, don't know that it spreads, and it spreads very fast. And then you lost a lot of people to cancer. So these children are working for me, and children as young as 8 to, of course, any age are working, and they do all sorts of things. So for one thing we do is a contest to create awareness, for which you can win 2 air tickets also. That's a prize. And an 8-year-old boy won the prize last year, and he donated the 2 air tickets to cancer patients. So it is awesome. I love him. I mean, he is, you'll find him on my page. Just go to my page. It's called Protect Your Mom, and you'll find a lot of videos, including the dance which won him a prize. And I'm sure in this community, your community will be the best forum to stage the same dance. You can stage the same dances, same skits, same posters in your community, starting with that, and then create your own dances, songs in Malayalam, Hindi, whatever you want. Because the thing is, you can identify with Malayalam better, obviously, or Hindi better among the Hindi community. So I have dances in I have one dance in Hindi, one in a multicultural thing. Arabic, the boy who won it used all the 3 languages. So stage the same dance, and of course win 2 air tickets. That's the highlight. And I'm sure I'll get more prizes also. I'm trying to get more prizes. I'm very busy right now. So that is one thing we are doing. And of course another thing is a trophy which I'm giving to the best school which organizes the best event for creating awareness. So Adanana Nyamparnile, DPS has done an amazing job. 3,000 students. They had a special event where the students were going around with placards and all that. The students were going around with all those things. You must see the video. It came on Asianet just about a week ago. And yesterday, 2 days ago, we had an even bigger event wherein 45 girls donated their hair for cancer patients. And you can see it on JHIM TV. It is there on my page again. I just uploaded it. So that is amazing because a chemo patient really needs hair. I mean, it's the most precious gift you can give because during chemo people lose their hair, not just the hair, the lashes, eyebrows, everything goes. So it is difficult for a chemo patient to face society after that. So we started this, and again I must thank Dr. Moonpan's Foundation because they are paying the wig maker for me. So here we have people donating from all over the world. Yeah, it's a very good thing which they're doing because so we have people donating from all over the world to this Hair for Hope India. That's my page. So you can go to Hair for Hope India page, and anybody can donate from anywhere in the world. For example, there's a lady in Kuwait helping me, and she's just found a donor. Now I'll get all those Asianet and Kairali and all to telecast it so that everybody knows about hair donation. That's how I work. It's a zero budget campaign. We're not spending any money other than the cost of the wig maker, which is of course being paid by Dr. Moonpan's Foundation. And we have just made the 4th wig in 4th month. We just launched it in June 19th of June, and we've already donated 4 wigs in the last 4 months. And one of the donees is in fact a student. She goes to college. Imagine going back to college after radiotherapy with no hair. That is the power of the wig. And we're giving it free of cost because the hair is donated. That's the main expense. And for making the wig, of course, these people are paying. And of course, it's a Facebook campaign. Next time you go to the parlor, tell them there is a way of cutting the hair, for example. So it has to be cut the right way. Loose hair is no use. You should make a ponytail and then cut, and it should be a minimum of 10 inches. There are a lot of these things like that. All the instructions are there on my page. It's called Hair for Hope, as I said earlier. And just go there. It's called, and anybody can help me by going to the parlor. Next time you go to the parlor, tell them, don't throw away hair, or you don't have to trim it so frequently. You just have to wait till it grows for 10 inches and then give it, because if you can help somebody with your hair, there's nothing more precious than that. And it's more important than even diamonds and pearls, because, without hair you can't face society. So that's about Hair for Hope India and Protecting Mom campaign.
Yeah. I'm ready to donate now, provided I chop it right.
She just wants to donate, and it's so nice to hear that somebody is donating right now, 10 inches. We'll do it right after the discussion.
Thank you so much, Mrs. Premi. We have some questions coming through the website. Good that people are watching us live. And we have this question, can benign or non-cancerous cysts become cancerous? Doctor, would any of you?
Actually, if you get you've been diagnosed with any benign cyst or any benign lump in your breast, that's called fibroadenoma, or any fibrocystic changes, we actually need to monitor that also. It's not that once you have been diagnosed with a benign and you can just leave it like that. Any benign thing if you have in your breast, and if you by self-monitoring or the other repeated ultrasounds, if you see that the size of the lump is increasing, or it is becoming painful, or it is becoming very difficult to move, which was freely mobile before, then this shows that there can be some sort of cancerous changes in that benign lump also. So benign lump, once it is diagnosed, there are certain size parameters like less than 3 centimeters. You can just leave it like that and do a repeated follow-up with the ultrasounds of the breast. But if it increases more in size, or if it increases more in size, or there is any change in the surrounding skin, any change in the mobility, anything you feel different as you were feeling it before, then you should immediately report to your doctor, because benign things can change into malignant, and it's not that once it is benign it's 100% benign. It's not confirmed like that. Okay. So always a repeat follow-up for any benign mass or any cyst in your breast is definitely required.
Now coming to the treatment part or the preventive part, I have a few questions related to that. First of all, now we have been hearing a lot of news about mastectomy. Now it's in the news mainly because some of the celebrities have gone for it. And what is the relevance of mastectomy? Can it be, is it recommended, and does it cure the disease, or what is the role of mastectomy actually?
Breast cancer is a surgical disease. The only treatment option is mastectomy and nothing else. If you want a cure, you do not have a choice. Now, the treatment is tailored to every individual, and depends on the stage of the disease. A small lump, you need not need a mastectomy. The breast cancer starts at an in situ. The earliest stage is an in situ cancer, where the cancer has not spread beyond the lining of the duct epithelium. So for that, what they do is they just remove the lump, exactly with a small margin. They remove the lump, a small scar. All you might end up with is a small scar on the breast. But then, based on certain other characteristics, depending what kind of a tumor it is, usually they also add on radiotherapy to that area, or maybe a chemotherapy also. So mastectomy is definitely taking out the whole breast. Sometimes it can be prophylactic, and especially people who are prone, because people with genetic mutations have a 55 to 65% chance of developing cancers, and if the risk is very high, for example, what Angelina Jolie did, they do a prophylactic mastectomy by removing all breast tissue, so they are free of this risk of cancer. Now, what they also do, especially when they have genetic mutations, is that they also remove the ovaries, because people have a very, very high incidence of developing ovarian cancers in genetic mutations. So for diseases which are at the later stage, mastectomy may be the only option. You may have to remove the whole breast. And then there's something called sentinel node dissection, because along with the breast cancer spreads to the lymph nodes in the axilla. But there is a problem about removing the lymph nodes in the axilla, is that because the entire arm's lymphatics go through the lymph nodes in the axilla. If you remove those lymph nodes in the axilla, the lymphatic channels get disrupted, and people tend to develop edema of the arm. It can be very troubling for some people. To decrease that possibility, what they do is there are ways. The technical thing is beyond the scope of this discussion. But we identify the single lymph node from the tumor site, and then we very close to the axilla, we just remove one lymph node and see whether it is affected by the cancer or not. If it is not affected, we do not go and operate into the armpit, into the axilla. So for the later stage, a mastectomy plus axillary dissection is the answer. For earlier stages, just a removal of the lump, and if necessary, radiotherapy, if necessary, chemotherapy is a solution. But in the earlier stages, sometimes in a lot of cases a cure is possible. You can be cured of a cancer if it's detected quite early, if the surgical margins are as recommended, if the tumor is not of a high grade histology which is the bad kind of a thing, and if you're free of lymph nodes, and then a cure it's a 100% 10-year survival rate, and that is the biggest thing which has come out of awareness, breast awareness, is early detection can lead to a cure. Normally people would equate cancer with an inevitable death, but now people have started realizing that if you detect it quite early, you can have a normal life. And even with mastectomy, when you remove the whole breast, there are options for of recreating the breast, either using body's your own muscle and shaping it to a breast, or using silastic implants to recreate the breast, and people can have normal lives after that.
Thank you so much, Doctor. Doctor, how about the role of alternative medicine in this? There has been a lot of debate, Could you please tell us about that as well?
I will tell you a story my wife told me. It is about a landlady. She had something in the breast which went on for some time. She saw a homeopath who told her, don't worry, that's the way they normally speak, in 3 months you'll be all right. It went on for some time, and that lump fungated, it came out of the breast, it became a big ulcer which started growing over months. Now the sad part is, her son was a doctor in the US, and she never told him that I have a problem with the breast, and the homeopath went on treating it. It essentially was a breast cancer which spread so much that it came out of the skin, it became a huge ulcer. Everybody came to know when she suddenly developed a huge bleeding from that. That ulcer went into a blood vessel, and then she had to be rushed to a hospital. There the doctors were very, very angry. Obviously they'll be very upset that a thing which could have been treated and dealt with quite early was missed. Because she insisted that the homeopath would do it, the son flew down from the US. Now, when the son was with the mother, the homeopath came and told, don't worry, even now I can treat you. Especially in Kerala, people have a fascination for alternative medicine because they want to avoid surgery at any cost. But with due respect to alternative medicine, they have their role to play. They are very ancient sciences, and they're excellent in certain diseases, certain conditions, but not in breast cancer. I think when you're dealing with cancer, alternative medicine does not have a role to play.
Thank you so much, Doctor. Doctor, we have heard a lot about the benefit of breastfeeding, and we have even heard that it can be a preventive measure against breast cancer. How effective is it, and what should actually the mothers do?
Breastfeeding is definitely protective against the breast cancer thing. Feeding the child for 1 year is very, very good to prevent against the breast cancer, because of the reason that while you're feeding the baby, you're away from those hormones which are under the exposure. You are always under the exposure. So this is the idea or the funda behind it, that why you feed the baby, which will protect you from the the breast cancer. One is the hormones, and the second thing is that the collection from all the breast, it goes up. And anyways, otherwise also, rather than your own prevention, it is very good to feed the baby, because the breast milk is very, very good. It provides so many nutrients to the baby as well.
I have a special story to say. We have this panel of beautiful ladies and this gentleman sitting with us, and I did not introduce a very special, wonderful personality with us. This is Tara Abraham, the chairperson of Khail Gate Ladies Wing, Khail Gate Malayalee Association's Ladies Wing. Tara is the chairperson of a group of ladies who have taken up this initiative to spread the word among the Khail Gate community in Dubai. And I'll hand over the mic to Tara and to talk a few words about the campaign, and also take a few questions from you as a woman participating in this event.
I think most of you know me, only the dignitaries on the dais wouldn't know me. She's introduced. Pink Drive is an initiative which I have just carried forward. Last year, it's the founder of Pink Drive in AKGMA stands there, the chairperson last year. I'm very happy to take that forward. It wouldn't come to my mind, to think of Pink Drive or to think of ladies being, given awareness about the campaign. So all thanks to her, and more than her husband, who gave her an idea of having it conducted. Okay, I have a question. Yeah, I'm sure this is breast cancer awareness program, but on the whole, I've read, we keep reading Google and Yahoo, and we get good information as well as wrong information. I've come across saying that there is a test now that you can do to detect cancer in any part of your body. It's a glucose test or something that cancer cells actually suck glucose.
You're talking about PET scan.
I'm not sure. Is it right or wrong?
She's talking about a PET scan. That's a different modality. I mean, it's a little it's away from the topic in the sense that what you read was right, and especially when you're talking about recurrent cancers, this is a beautiful. Let's say it's a big MRI or a big CT scan, whereby a scan is done on your entire body. And before that, we give a small injection of a special glucose which is attached another tracer which can be detected by the scan. So those tissues which pick up this glucose avidly, or where the perfusion is much higher, like for example in abnormal tissues and cancer tissues, it will pick up this glucose more than the normal tissues, and that is picked up by the scan. Now, it's supposed to be very, very specific for most, especially recurrent cancers or cancers which see, once you do a surgery, that area is scarred. It's a normal part of healing. There, if you develop a cancer again, how do you know whether it's a scar or whether it's a cancer? So for this, these things are useful because it uses the tissue's metabolism to tell us so that it reveals itself. And what you read about was the PET scanning. It uses a modified glucose as a tracer, which you inject and then you do a scan.
But that's not for the regular cancer.
No, not for the regular cancer.
Thank you so much, Doctor. I guess we are running short of time, so we will take questions from the audience now. So ladies, please, this is the time to shoot all your doubts and questions to the panel here. I'll start with Prasita, who actually introduced this concept to us. She and her husband were the ones who behind the Pink Drive, in our community. So welcome, Prasita.
Thank you. I'm really happy to see that Khail Gate Malayalee Association, in association with ASTER, we are doing this second year breast cancer awareness camp, and we are really happy for that. And thank you all for being with us. Actually, I am a mom. I have a daughter. So, and most of us here, they have their daughters in a teenage. So, how should a mother connect to her daughter so that she starts advising her, or which stage can she connect so that she gives her or transfers the breast cancer awareness to her daughter? That is my question.
You will not believe, my daughter just showed me before I was leaving a notice from the school, and they are supposed to wear pink top on Wednesday. And she asked me, she's like spot, she was 7. She asked me, Mama, what is this pink awareness and what is this cancer? And she could not pronounce awareness properly. She said, what is this cancer awareness? I said, I will come back and then tell you. Read what is it. And I said, just watch me on the website. But yes, you can. If a daughter is young, then it is naturally not needed. But then, of course, if she is in early teens, that you should tell her about certain things. Most important, again, I'll come back to the self-breast examination. If she's in late teens and if she's married, then of course, after 20, she should undergo, as I said previously, again the clinical breast examination. So I would like to highlight, I have a slide here. Would you mind if I show it? I'll finish it in 3 minutes.
Yeah.
It is on the self-breast examination, again, which is very important and which is the most important thing. So if you can just show it on the screen.
The right time to do the self-breast examination is after the menstruation is finished, around day 6 or day 7 of your periods, because that is the time when the breasts are least congested. There is no congestion, there is no fluid retention because the periods have already been through, and any difference or any change in the texture or density of your breast you can make out very properly. So step 1, there are 2 things. One is inspection, second thing is palpation. Inspection means just the visualization of the breast, and palpation means touching them and then feeling the tissue itself. So first is inspection, step 1. Begin by looking at your breast in the mirror with your shoulders straight and your arms on your hips. Mirror is the best friend of the woman. So you can stand in front of it. And here's what you should look for: breasts that are their usual size, shape and color. Breasts that are evenly shaped without visible distortion or swelling. Swelling part, Dr. Mahindra has spoken enough, so you should able to make out if there is any swelling or any mass in the breast. If you see any of the following changes, bring them to your doctor's attention. Another thing is dimpling, puckering or bulging of the skin. You all must have seen the orange peel, how it looks. That thing is called puckering or dimpling of the skin. If there is any such thing on your breast skin, then you should bring in the doctor's notice. A nipple that has changed position, because if there is a tumor inside, the nipple will get either pushed to the opposite side, or if it is fibrotic cancer, then it will pull the nipple in. So any change in the position of the nipple is again very important thing to notice. Redness, soreness, rash or swelling, because the Paget's disease which the doctor spoke about. So any of this, at times there is rashes which are coming, scaling which is happening on the nipple skin or on the skin of the breast tissue itself. Anything which you see amongst these 4: redness, soreness means when you touch it and there is pain, that is called sore. So if there is that, rash or swelling, then you should bring to your doctor. Then another thing is, raise your hands, take them above your shoulder, that is the position, and look for the same changes, because when you do like this, you see your armpits, that we call axilla in our tongues. Armpits are very important because there the lymph glands are, where the cancer of breast is getting filtered and getting collected. So examining of the breast itself is very important. Front view, lateral view, both the views, and raising your arms, again looking for the armpits. While you are at the mirror, look for any signs of fluid coming out of one or both the nipples. This could be a watery, milky or yellow fluid or blood. It's not necessary if either of these secretions are there that it is a cancer, because the doctor will investigate. But if it is there, when you are not feeding the baby, you should bring it to your notice. Next, feel for your breast while lying down. How it should be done? With the 3 of these fingers, not poking it in, but this surface. The surface of these 3 fingers, it should be used for the palpation of the breast. Not poking it in the tissue, but using it and moving it in a clockwise or anti-clockwise, the way it has been shown. You can do it by lying down. The side of the breast which you are examining, that side of the hand should go beneath your head, the way that lady is lying down there, and use the opposite hand to examine. It doesn't matter whether it is large or small. You should go in a clockwise direction or upwards, downwards, in either of this way you should do it. And use your right hand to feed your left breast, and then your left hand to feed your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping the fingers flat and together. Use a circular motion about the size of a quarter. Cover the entire breast from top to bottom and side to side, and again go for the axilla. Examine the axilla the same way, and if any change you notice, go to the doctor. This is what is called self-breast examination, to be done every month by you. It will take hardly 3 to 5 minutes. Give that time to your body. It deserves it. Okay. Thank you.
One more associated question. How frequent should we go for this?
Every month.
Every month.
Once a woman finishes her periods around day 6 or day 7, every month. It hardly takes 5 minutes.
Ma'am, one more question related to what Prasida asked. She was asking you how mothers should connect with the child and then start awareness about this. And coming to that, girls, especially teenagers, they have a lot of inhibitions in discussing such topics. What can mothers do, or teachers, or anyone else for that matter, to let them help open up and then discuss these issues and how can we spread the message to them? We know that, for example, as Mrs. Mimi said, kids are the best way to spread the message to the family, but how we can help the kids themselves, the girls, young girls?
Yes, it's very important. See, our culture and our society is such that certain things are inhibited to talk about. One of them is, when a girl reaches menarche, to talk about puberty, the starting of periods, the growth of the breast, and most of the times the girl find it, she may discuss it with her friends but not with her mother. She may discuss it with her elder sister but not with her mother. So it is, and she should not be told that it is a bad thing or it is a taboo or it should not be discussed. Yes, it should not be discussed in public. She may not like it. But yes, a mother can be her best friend and she should tell her that this is the way the growth happens, this is the way the menstruation comes. These are the things which will change your body in the next 3 years, 4 years. You will have to take all these precautions, and if you find any change in either of it, any change in the menstruation pattern and any change in the growth of the breast, then it is daughter's, she should come out with it and tell her mother, and a mother's duty to notice it and not ridicule her and not tell her in a maybe at times with the administrative way. You can just ask her, yeah, if you have any changes you have noticed. Like, I will not say about these two things also, but the other things are there which are to be discussed with the early teen daughter. So you can discuss it. Try to be more friendly with her. This is very important.
Thank you so much. We have just been told that there's a problem with the audio. I hope this is clear better now. Any more questions? Or maybe one or two more questions? Yeah.
It's about mammogram. Is it painful or what?
This is a very myth about the mammogram, that this is very, very painful. But yes, of course, it is a little discomfort in doing the mammogram. Because as a females, we always feel that we have to show the breast at what they are going to do. It's just not like a simple X-ray. It is not painful, but yes, little discomfort definitely you will feel while doing the mammogram. Because what they do is that they will keep your breast tissue in between two X-ray plates. Okay, so that tissue is little pressed in between. So at that time you can feel little discomfort, but of course the pain is not that much that it will bother you later. It is just a pain for discomfort for 1 minute, because they have to take 2 views, and they have to take 2 views from both the breasts. So it's total 4 exposures you have at that time, and every time in between the 2 X-ray plates they are going to just press the breast little at the time of just taking the X-ray. So it's not that painful, but yes, little discomfort anybody can feel while doing the mammogram. But that little discomfort, I don't think so it's too much to avoid a mammogram.
Yeah, one more question there.
Is a lady, unfortunately, she had taken a tablet to suppress the breast milk production. What is the chance for getting the breast cancer?
No, it's not related to that drug. Yes, it is related to the drugs which are taken for infertility or hormonal replacement treatment, but not related to the suppression of milk. Yeah.
We have a question from the webcast. This lady here says she is 37 now and she has a family history of breast cancer. So she's asking if she needs to go for mammogram at this age. She's 37.
See, if she has a family history, then she is definitely 3 times more prone to that. We have very good medical facility available, that is BRCA1 and 2, because out of 2 gene mutations, which happens in almost 1 woman out of 200, which is very high incidence, and if they have this mutation, they have 85% chance of developing cancer breast. So she can go for that, or she can go for the mammogram. Ideally, she should go for the mammogram along with the ultrasound, because Before 40, generally the breast tissue is very dense, so mammogram alone cannot diagnose. So simultaneously, she should undergo with an ultrasound of the breast also.
Yes. Once diagnosed with the cancer, surgery is the only option. Now, for a smaller scale of a surgery, for example, just removing of the lump, it may take only about, say, 3 or 4 days for you to completely recover. If it's a mastectomy, it may take maybe a week. If the axilla lymph nodes are also removed, that may take maybe about 10 days or more. But then you must remember that we are operating in the region which is just below the skin. We are not entering any major body cavity. So, though there might be a little bit of discomfort because of the surgery, one should be able to do all the normal activities. I don't think there will be any restriction on any activity just because you've undergone any breast surgery, and apart from wearing tight supports which will relieve pain if it's a lump excision. Otherwise, I think people can recover very, very fast, in about between 3 days to a week should be more than enough. Does it answer your question?
And I mean, how much time will it take to recover from that?
You recover as soon as you're free of your pain. I mean, no, I get your question. Now, see, once we remove the lump, it is sent for the final biopsy examination. That they will run through a series of tests. What grade is the tumor? Are the margins enough or not? And based on that, if the margins enough, the grade is less, you can just leave it like that. If the tumor size is also very small, you can leave it like that. If the tumor histology is not very favorable, then we may add a radiotherapy to the whole breast or to that selected area. Or you may do something more. Suppose the margins are very less, you may have to go and operate again to get some more margins. So there are a lot of variables in this. So it's very difficult to pinpoint and tell you an exact time when a person might recover from a surgery. But roughly, if everything is okay, I think about a week's time is more than enough. A week's off from Dubai is quite a lot.
Questions, one to the doctor. The doctors, that is anybody detected from breast cancer below the age of 20? Do you know anyone? Or
Survival rate, you mean?
no, is any girl detected?
No, there are. In that age, yes. Very rarely you have breast cancers at that age also. It's very, very less. It's very, very less. The majority is beyond 50. And the major chunk is 70 to 80 and in that age group. But yes, even at 20s, people have been treated with breast cancers.
And Mrs. Matthew, I just wanted to check with you about donation of hair. Like, apart from, you have to just contact your Facebook, or is there any institute here?
Actually, anybody can donate from anywhere in the world, and since she is planning to donate, we'll cut it right now. So could you come please? You're in charge of cutting her hair. Come. No, I'm talking to you, yeah. Come. We'll demonstrate it right away. Okay. We'll demonstrate it right away because she just volunteered, and can you come, you're in charge because you have to show the whole world how to do it. Each one of you can volunteer for me. Because this is not an organization, it's only a Facebook campaign. And you have to make a ponytail, measure 10 inches minimum, make it 11 inches. Can we have the audience to see it? Yeah, she's already agreed. So she is making a ponytail of 11 inches minimum, 10 is enough, 15 is better. Alright? So she'll make a ponytail of... She just volunteered, she hasn't asked anybody, and I'm a little... I know.
No, I'm just
She just decided about, this before the program. That's how it happens, We had 17 people donating on the very first donation. Mr. K. Mani? Minister Narya. His daughter was the first to donate in India, Kerala. And we had 17 students immediately ready to donate. So that's the power of, this donation. And it's... Oh, well, her hair is very thick. So normally we need about 6 to 8 ponytails. It depends on the thickness. 11 inches. Her hair is very thick, so it's better to put 2-3 rubber bands. And you're going to see a live demonstration today.
I think this is really a good thing that we all can know exactly what will happen when we go, and we can easily say, okay, I'll go and donate. But this is what is going to happen, so you can take a firm decision after this demonstration. You can also.
So she's made a ponytail like this. It's better because her hair is very thick. Okay. Now measure 11 inches from the bottom. 10 is enough, but 11 is safer. 11. Very precise. I don't want to cut her hair. So we make a ponytail of 11 and put another rubber band on top of it also. So 11 and 12, keep 2 rubber bands. Alright? Keep as many rubber bands as possible. It's better that. We have, sorry, so this is at 11 and this is at 12, and she's going to cut in between these two. So camera can focus on this particular.
This is indeed a very noble gesture from Dr. Khail. Please give her a round of applause. We are so proud to be part of this.
Everybody is welcome.
Thank you so much.
Hope you will welcome at home.
Yeah.
I'm not very sure about that. So that's how you cut. Anybody can train anybody. And Hair for Hope India, please be on the page today. You'll find a lot of videos on the page. And it'll be on Jai Hind TV tomorrow, day after, Gulf Roundup or something. It's coming again.
I think that we are getting a lot of media exposure as well. Like the word will go to a lot of people.
It's been there on Asianet, Kairali, everything.
And we hope that Dr. Khail's hair will be useful for a very pretty lady.
Just plate it before you cut. So that it's really, really thick. So that's it. Can you hold it and take a picture, please? Isn't it a picture? No, don't leave it. Probably you can just hold this. That's enough. I don't want trouble at home. 15 is better, but she just took a decision suddenly. And 10 is okay for us. Let them see the ponytail.
Don't you think she's looking more beautiful now?
And it's going to give a smile.
It's okay as long as it can put a smile on somebody's face. It can again regrow, We say in Hindi it's kheti.
Yeah.
No problem.
If you have any more questions, we have sessions with the doctors 101. We will be having clinical examinations, and doctors will also demonstrate how we can do self-examination. So we will be continuing with those sessions downstairs at the clinic. Now we will have a cake cutting ceremony, wishing every woman the peak of her health from AKGMA is what is written on the cake. And after the cake cutting ceremony, we will proceed for the further sessions. We would like to invite Mr. Jalil from ASTER. He is representing both ASTER and AKGMA. We are proud to be associated with him in both the ways. He is the director of PR and CSR at ASTER Group, and also the president of Khail Gate Malayalee Association. So he is the right person to give this honor. I would like to welcome all of you, the doctors, Mrs. Premi, Tara, all of you please join. Prasida, if you could also join. We will have the cake cutting.
We have Mr. Gopinath representing.
We have Mr. Gopinath also representing Medcare, sorry. Ladies, this is for your health. We'll have the cake later, and now we'll move on to the photo session. The session of photo thanks. Tara will be delivering that.
Since it's late, I'm not going to take too much of your time. I want to thank all the members and the guests who have come here. ഞങ്ങളുടെ ക്ഷണം സ്വീകരിച്ചു വന്ന എല്ലാവർക്കും എൻ്റെ ഹൃദയം നിറഞ്ഞ നന്ദി. A special thanks to ASTER as well for conducting it in this way. Last time we had it in our premises, but we have a clinical doctors to examine. So I'm sure we've gone one step ahead. Thank you everyone. Thank you Jalil once again. And thank you Sajila. You have been wonderful. And Previ ma'am, it was a pleasure meeting you. And all the doctors, thank you from the bottom of our heart.
We will all proceed for the next session at the clinic downstairs here. Thank you all. I hope I did justice to what I was told just 1 hour before the event. Yeah, thank you. We have one more thing to do here. We have a few gifts to be given away to the lucky girls or the ladies here. There will be one special lucky draw prize from ASTER. This will be a well-woman package, and there will be a raffle for that. And from AKGMA's part, we will also be conducting a raffle, and lucky winners will be given prizes here. Ladies, 6 lucky women among you will be getting a well-woman package from ASTER Medical Centre.
Okay, so
Do
I have any kids here who can choose the lucky one?
We have this pretty girl, our own Premalada Chechi's daughter.
The first winner.
This is Priya KR. Congratulations, Priya. We will be handing over the vouchers for the packages later on.
Sajila, check the mobile number.
Yes.
Ask them for the mobile number.
I guess there is no other Priya KR here, but just to make sure that it is the same lucky person, could you please tell me the last 3 digits of your mobile number? Yeah, that is. Shaimol Salim. Shaimol, can we have the last digits?
740505.
Exactly. I would like to take this opportunity to thank Shaimol and her husband, because her husband Salim is the one who has sponsored our gifts for the entire ladies. So this is a God-given gift for her. This is Mrs. Premalada. The daughter has picked her mother herself, yeah? You know that I don't have to ask the number now.
Okay, now another kid. I don't want Pinky to pick up.
Pinky's mission is over. Yes, we have a smart boy here. Jinsi Libo. Can we have Jinsi? The last number? We have only one Jinsi here, I know, yeah. Congrats, Jinsi. We'll take 2 more. We have 4 already. Lucia Mubash. Yeah, congratulations, Lucia.
Last one.
The last lucky winner for this well-woman package from ASTER, Mrs. Girija Ravindran. Girija Ravindran, she's our own Giriji Chichi. She's a very active member of the Ladies Wing, even at this age, and not that she's very old. She is young at heart, and she's one of the best coordinators. And this is also a right gift for her. We have got 6 of them already. Now we will have the raffle for AKGMA gifts. She gave me one. She has chosen Sumita Rajagopal.
Sumita is here?
Sumita?
No.
Okay. She must be waiting down in the procession. She was
There's another one.
watching her.
Oh, okay.
So we give the prize.
Okay, we'll hand over the prize later. Give me, baby. We have Gina Jolie Raj. I request Mr. Gopinath to give away the prizes. Kavita Mohan.
If you are here, can you please come fast?
Yeah, could you please come fast? Yeah. Ambika Nair. Yeah. Yeah. I request the doctors also to come forward and give away the prizes. Sini Banumati. Can Anju Shibu come forward, please? Anju Shibu. Mrs. Premi, please give away the prizes. Usha S. Nair. See, we have all elderly citizens also being part of this pink event in pink dress. Linda Thomas. There is no time now, otherwise we could have. Ponnamma Gopalakrishnan. Mrs. Ponnamma Gopalakrishnan, our one more mother from our AGMA. Shamima Rafi. Dr. K will be giving away the prizes now. Shamima Rafi. Sandhya Santosh. It's not the mother-in-law, the daughter-in-law is also taking away the prize home. Siji Sumesh, my own neighbor. Congratulations. Oh, this is none other than my mother-in-law, Sumati Kutan. Dr. Asta, if you could join us for the prize distribution. We have Rasia Rahim. Subhita Prasad. Ladies Wing member, Subhita Prasad, please. Prajina Vinod. Yeah, Prajina came because of me. Christina Shiju. Shiny Shajuddin. Our own Shiny was a very active volunteer. Okay, Shiny is down, so we would like to welcome Tara Villan. Anjana Nair. Down. Yeah, she is also down. So these are all our active members. Dr. Risha, please. Ajita Dinesh, Reni Titus. Thank you. Nikita Bhagwani. Do we have Nikita here? I'd like to invite Senior Manager Nursing, Mrs. Anu, to give away the prizes now.
Lucky last one, huh? Yes. Seema Jalil.
Wow. Yes! The right person to receive this. Mrs. Our First Lady, Mrs. Seema Jalil. Yeah. Yeah. Thank you so much and congratulations to all the lucky winners. We will proceed for the next session now. Thank you.